Good afternoon. Darwin had said that in evolution there was nothing more complex than function and structure of human retinas. Such intricate complex of connections modern technology has not been able to simulate. 80% of experiences go through the eyes. In today's show you will hear stories from people who rediscover the beauty of sight, magic of emotions, experiences, receiving emotions, every information that goes into that small, incredible organ called the eye. In the very beginning starts with the story of parents of a boy who was enabled to meet the world through the sense of sight. And the initial prognosis was scary. Please meet my first guests, Elvedina and Arnel Beganovic, with their son Adnan. Welcome. Please sit. Adnan, welcome. Beganovic family from Lukavac near Tuzla. Your son had problems with sight. What was it? Yes, he was 2.5 months old when we took him for the first exam in Lukavac. We were told it was conjunctivitis, but sent us immediately to Tuzla, where we were told he had glaucoma and cataracts, and it had to be operated immediately, but that the operation was only to stop growth of the eye, not to expect anything for the sight, so prognosis was not good. Baby was small, you were new parents. How did this affect you? It was shocking. When we came back home, we did not want to stop there. We did not want to give up the fight. My husband said that he heard about Hospital SVETI VID. We called and scheduled exam. When we were examined, they told us about glaucoma that had to be operated, but did not tell us about cataracts. After 10 days, surgery was done, and everything, thank God, everything was okay. He sees well now. It would be such a pity for such a beautiful boy not to see. Did you first notice some symptoms when he was baby? Yes, we noticed that one eye was larger than the other, but we were not informed any further. So that made you look for professional help, yes. How did Dad feel about all this? Newborn son having a problem. It was shocking to us. Even my father noticed. He even suggested to go to America for help. But when we came to SVETI VID, it changed my life. Professor changed my life. I was scared that my child would be blind, and I could not find peace. Now my son sees everything. I'm so happy. Which is essence of our existence, to be happy. Does Adnan go for checkups, controls? Does he go to SVETI VID? He has great vision. It was their success, but he has regular controls. When the eye pressure is checked, thank God everything is okay. We were just there a few days ago, and the next control is 1 year. Thank God. Congratulations. These cameras are affecting him. He was nervous, but now he's very calm. Let's say hello to your doctor, who is coming from Belgrade, our known guest, and find out what treatment was performed to Adnan so he sees well now. Dr. Marina Dragovic, welcome.
ja Adnanu rekla, sad ćemo pozvati tvoju doktoricu da objasni, on je lijepo klimao glavom, jedva je dočekao da nam dođete ovdje, baš poput mene.
This is an opportunity to start and talk about subject which is perceived as very serious and scary, yet solutions are there if acted in time. This was a case of congenital glaucoma in stadium, when eye is enlarged, which we call ophthalmos, because of very high intraocular pressure in child's eye, which mother noticed. It leads to enlarging of bulbous and stretching of eye structures, and to visible clouding and thinning of cornea. So there is a danger of serious defects which can lead to corneal scars. Such high pressure in adult would not be able to stand, which would be excruciating pain. In child, because of soft structures, stretching elastic, occurs compensation, practically the laws of physics. The pressure is compensated on behalf of volume, which is good for children, so the optic nerve is protected just long enough to give us time to react. In early shows, I emphasized that congenital glaucoma is a problem that needs to be acted upon timely. And in this case, it was with parents. They acted in time, we acted in time, and the results are visible. The pressure was enormous. Maybe because of swelling of cornea, cataracts were declared. There is no cataract, not in stage to be operated. So the combined surgery was performed. Professor Autrata performed trabeculectomy combined with the iridectomy, which is safer for the child's eye, and the result was immediate regulation of pressure. The pressure is completely normalized, cornea completely transparent, creating essential condition for sight development. Comparing a glaucoma in adults and children, the approach is diametrically opposite. In adults, therapeutic approach has good results and compensation of pressure adapted to different type of glaucoma. As long as pressure is compensated with drops, we do not opt for surgery. Only when drops do not compensate pressure any longer, deterioration of optic nerve is visible. Why do we talk about glaucoma as sinister disease that silently takes away and destroys sight? Because it is a disease that initially, in the beginning, does not manifest pain. The pressure can be 26, 28, 30, with visual field defects, and it does not show flagrant symptoms. Pain occurs with much higher pressure. In child, pressure was 46 to 50 without pain. In adult, it would be excruciating pain. In adults, it is not followed, if not followed regularly, not thought regularly on ophthalmological exams. Omitting to do, so only central visual field remains and periphery is destroyed. Patient gets surprised when told that atrophy, destruction of optic nerve occurred because of high intraocular pressure, and they don't even know it, because often ophthalmological exam suffices with only prescription writing. But ophthalmological exam must consist of not only intraocular pressure measurement, but detailed exam of back of the eye, not only macula, but papilla as well, examination of the head of the optic nerve. How can parents notice? How can adults? Yes, in this case, mother noticed the size of the eye, which can be also sign of high myopia. In any case, the axial length of the eye must be measured, the intraocular pressure must be measured in children. systemic exams need to include ophthalmological examination, so parents can be pacified, relaxed, that their child would be completely examined, that they don't have to think themselves. But that is not the case. Parents pay attention. They are first who signalize symptoms in newborn. Sometimes in drastic cases it is detected in delivery hospital, but often it is missed. Often it is enlargement of the eye, enlargement of cornea, spreading, thinning, often clouding of cornea, giving false reading to be cataract, but the lens actually cannot be seen because of intense clouding and swelling of cornea. In this case, this was a sign for parents to search for help. In any case, why do we say it is sinister disease? Because it progresses in stealth. One cannot feel the rise of pressure. There are no pains, but it does not mean that the optic nerve does not suffer. We always follow. 1 month, 3 months, 6 months, yearly. In this case, there is no need for drops because the pressure is compensated, but regular controls are needed as child grows and develops. So, if situation requires, the drops may be introduced as like in hypertension therapy for life. The disease must be kept under control. Thank you very much.
Na redu su reklame. Brzo se vraćamo, ostanite uz nas.